We're going to move on to the topic of mental health. And we would like to know what actions, including preventive actions, would you take to promote the mental health of Northern Manhattan residents in general, but to promote positive early childhood social-emotional development? So you sort of like get to that.
Yeah, well,
Yes, sir.
Well, I've talked about this throughout the whole campaign. I believe that we're missing the boat when it comes to early intervention. A lot of our kids are coming into our school building, particularly from poor communities, way behind at 4 or 5 years of age. We now know, and parents know this, it's not an IQ issue. It is a poverty issue. Poverty causes stress, stress causes developmental issues. And it's those 3 years, 0 to 3, are essential, and we're not doing much about it. We all support full-day kindergarten. We support stop closing our schools, stop teaching to the test, but we're neglecting that 0 to 3 age. And I want to set up a department for early learning where we consolidate all the early learning programs in the city into one agency so they're not spread out, we can get more efficient about it, and set up pediatric wellness centers in low-income communities where doctors, parents, and teachers work together as soon as the child is born. We have now compelling evidence that those first 3 years are pivotal. So I consider it political malpractice not to address it early on, because these kids wind up being referred to special education. Many of them wind up in our criminal justice system. So the investment early on makes a lot of sense. It saves us money in the long run. It's the way to go, and it's one of the mainstays of my education plan, and will affect, obviously, mental health and all the other issues that kids, unfortunately, are afflicted with.
Thank you so much, Mr. Albanese. Mr. Carrion?
You know, I think one of the biggest opportunities that the mayor has, or the chief executive of a city like New York with 8.3 million people, and the bully pulpit that it allows you, is to take that opportunity to help remove the stigma about mental health and mental health services and mental wellness. We have created this big bugaboo in our society that as soon as you go for therapy or you go to see a psychologist or psychiatrist, there must be something wrong with you. Well, breaking news, we all have mental health issues that we have to deal with. And we need to make it part of the, if you will, diet of health and wellness rather than separating it as a separate category. And I think, you know, just in terms of the powerful symbolism and opportunity for leadership in this space is to really champion mental health services. And of course, you know, there are difficulties associated with poverty and with urban living that have to be addressed. But I think the mayor using that bully pulpit to its fullest extent is probably the biggest opportunity we have as chief executive.
Great. Thank you so much. And you stayed on your time. Great. We are going to skip Mr. Liu. We're going to welcome you warmly into our forum. But we're going to skip you to give you the benefit of like getting settled. All right? Thank you for joining us. Reverend Salgado?
I believe that we have to improve the services for mental health patients through community-based programs. When we talk about patients with mental problems not getting the services that they need, we are talking about the whole community suffering from the consequences of that person not getting the help that they deserve or that they need. Therefore, we have to continue with the current program that we have in the city, and we have to make sure that we improve them in a way that they best serve the different community. We also have to have a better communication between our police department and this community health center, because many times when a patient that is suffering from mental health problems is apprehended by the police and is retained for over 24 hours, they automatically release that person to the public without ensuring that that person is going to get the treatment that they need and the medication that they also need. And most of the time, that could result in a tragedy for the person or the patient himself or any member of the community. So we have to make sure that we have that communication between the police department and these health community centers. Thank you.
Thank you so much, Reverend Salgado. Mr. Thompson?
Yes, I think there are a few things that we can do when it comes to mental health. I think that the first thing, as we start to look, is to really stop the defunding of a lot of the smaller CBOs and community-based organizations that have been providing services. You've seen consolidation of those dollars over a period of time as they're drained out of communities and put into larger organizations. That needs to stop because a lot of those community-based organizations are providing mental health services in communities. Second, I think the community schools and the Cincinnati model, and I was out in Cincinnati, you're seeing some of that in New York City now. I think there are probably 8 schools or 9 schools that are employing that model that provides both health and mental health services to schools. So when students, instead of suspending a student, instead of penalizing them for some of the things that they go through, for a fight, for a disagreement, for others, those students have access to mental health services also, as well as their families. Those are things that are very helpful. And then last but not least, looking at, and it's something I've always advocated and believed in, a string of primary care facilities that provide both health and primary care, mental health services to communities, rather than waiting for people to have to go to a hospital, rather than waiting for people to have a major problem. They can be treated and dealt and have the opportunity for those health care services earlier. I think those are ways, and particularly on the mental health side, that we can bring some of the issues that affect communities in the northern Manhattan community down.
Thank you so much, Mr. Thompson.
Well, thank you very much. I apologize for being a little bit late, but nonetheless, I'm very happy to be part of this important forum. And these issues that pertain to people north of 96th Street are important to many people across the city. But we also are very cognizant of the fact that there are disparities that affect people uptown much more so than in other parts of Manhattan and New York City. And with regard to some of these mental health issues, I would start in the schools. I've got a plan that looks at not just providing universal pre-kindergarten to 4-year-olds in this city, but I think we have to start much earlier. Preschool is something that many 3-year-olds in this city go to, but it's generally to the more well-to-do families that can afford to send their 3-year-olds to private preschools. I've got a plan that will provide preschool universally to all 3-year-olds, because I do believe that 3-year-olds have the capacity to learn. And the earlier we can start kids in school, the earlier we can detect some of these issues that may come up, particularly with regard to mental health. There are also studies that show that if we start these kids down the right path in terms of learning, we might be able to forestall some of the issues. I was also in Cincinnati with Bill. While we were there at different times, but we saw the same model, where you have programs like nursing. Wow, that's a really fast 1 minute.
Yeah, 90 seconds.
You have that was okay, even faster than 90 seconds. The nurse practitioner partnership is something that I've advocated for, where we actually have the nurses working with families to identify issues even before any of the children get into school.